Hello and welcome to this show today. This is Dr. Aurora Maranga. Today we are going to start a series which we're going to look at for the next few weeks. And the series is on infertility. It's a very interesting topic which is at the heart of fertility in couples. So today we're going to answer this question, why am I not conceiving? What's the reason why you're not conceiving? You've been trying for some time and maybe you think there is a problem. Maybe there is, maybe there isn't. So what is infertility? Medically speaking, infertility is when a couple is trying to conceive, they're having regular and protected intercourse for a year and there's no conception. Now, that of course goes against what most couples in our clinic. Sometimes we have couples who come, they're very, very anxious and they've been trying for a couple of weeks, sometimes a few months, 2 months. And then after that, they start having anxiety and stress that they're not having a conception. So when such come to our clinics, usually we would counsel and reassure them to continue trying because there may not be any problem. Infertility, it's not just a woman's problem. It's also in men. And if you look statistically, men and women, they have almost similar percentage of infertility, accounting for infertility. You find roughly 30% of infertility is caused by the male factor. You find within couples, the male factor accounts for 30%. Women would account for around 30 to 40%. And then both of them, where you have both couples have an issue, might account for around 20%. There's also a percentage whereby you find that it's not really explainable. We call it unexplained. So what causes infertility in women? You can start with women. Infertility in women, you have to look at this, how the body is functioning. We call it physiological. How the body is structured. That one we call it anatomical. And the commonest in this case is usually tubal factor, whereby you find maybe a woman may have had a previous infection and the tubes got affected and they got blocked. That is generally when a woman has had pelvic inflammatory disease. You could also have tubal blockage due to endometriosis. Endometriosis has become pretty common in our setup. Those are conditions which cause inflammation within the pelvis. So you find that the tubes have actually gotten blocked. The other common aspect is hormone imbalance, where you find a woman is having conditions like polycystic ovarian syndrome, PCOS, as we call it. And in that case, you find a woman may not be having ovulation. So she may be having periods, but maybe the periods are irregular and she's not ovulating, or she may actually stay for a long time without having periods, and that is polycystic ovarian syndrome. And there are also other conditions in women, depending also on the age. Age is extremely important. As a woman ages beyond the age of 35, going upwards, and especially after 40, you find fertility tends to decline quite fast. So there are many reasons why a woman may have difficulties in conception. Now, if you look at the men, it's also pretty common. You find a man may be having low sperm count, poor sperm count, poor quality of the same, or sometimes we find men who don't actually have any sperms, which could be genetic. And a number of times also could be a previous infection, a man may have had previous infection, causing maybe blockage of the tubes which bring the semen out from the testes, call it the vas deferens, or hormonal issues, which could be genetic also, whereby a man may not be producing sperms or may actually not be producing adequately. So those are also hormonal issues which could cause male infertility. Of course, lifestyle also applies a lot, both in men and women. Lifestyle here, we are talking about like excessive alcohol intake. Everything in life is always in moderation, but if there is excessive alcohol ingestion, excessive smoking, that can also impede, that can actually affect the level of fertility. The other lifestyle is the kind of work a man is doing. Nowadays within 𝗘𝗅𝗽𝗶𝗃𝗏, 𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏𝗏 advice to them is to wear loose clothing and basically to ensure that they're not seated on the hot engine all the time, or at least find a way in which not to heat up where they're seated. So in other words, those who work with, say, boda riders, or those who work in very hot environments, in factories where there's a very, very high temperatures, which do not allow proper maturation of sperms, you find the sperm contents to reduce. Also, things to do with the diet, obesity. Obesity also tends to cause infertility or reduce fertility, so to speak, in both men and also in women. So when couples come to us in the clinics, what do? So we usually would try to understand where they're coming from, how long they've been together, whether they've had any use of previous contraceptives, whether they have used the pills before or injections, and for how long they have been off those contraceptives, and for how long really they've been trying to conceive. Sometimes couples come to us, they probably live far, maybe one partner stays in a different town, so they meet infrequently. And you find when you take the history, it is more of reduced contact between the couple. Maybe they meet when the woman is actually not ovulating. So we do take the history to get to understand where the problem might be. And then after that, we do examine the patient to find out what the problem might be also. Maybe she has fibroids, maybe she has infection, maybe whatever the problem that may be there. After which we would ask for investigations. There are various investigations which would usually require, for a woman, would usually require a pelvic ultrasound scan to check on the reproductive organs. And we also would check for the tubes, test an X-ray which we call HSG, which is basically to check whether the tubes are blocked or whether they are normal. And then we may send the patient, if we suspect hormonal imbalance, to check the blood for the various hormones which would account for fertility. And that would tell us if she's probably ovulating or she's not ovulating. And the other tests will actually depend on what else needs to be investigated, but those are the main ones. And for the men, usually the male partner will send them for semen analysis. The semen analysis, usually we advise the couple to abstain for at least 3 days before the specimen is given, and it should be in the lab within 1 hour to be analyzed. And we would usually check what's the sperm count like, whether it's normal or not, what's the volume of the semen which has been submitted, and the quality of the sperms, whether they're mobile or not, whether they're normal forms, and basically to give us an indication whether there is good fertility or whether there is a problem concerning the man. And thereafter then we would come up with a plan of treatment. And luckily in this country we now have almost all the types of treatments which are available anywhere else in the world. And the treatment would usually depend on what the cause of the infertility, if it's the male factor, and if the sperm count is low and maybe there's hormonal imbalance, then we may give hormonal medication to the male partner. For the woman, the same thing if that's the cause. If the tubes are blocked, depending on the level of blockage, we may advise to have surgery to unblock those tubes. More often than not, we may advise to have other types of treatment instead of doing the what we call ovulation induction, where we give the patient medication and ask them to take in a particular way, and also to time when they're likely to conceive, so that a woman is able to know when to conceive. And if there are other problems, we may advise for intrauterine insemination. Intrauterine insemination is when a woman is basically able to ovulate and the tubes are okay. And the challenges in conception, we ask the male partner to produce their semen, which we process in the lab, we concentrate it, and then we deposit it directly into the uterus, and then the sperms have a shorter distance to travel towards the eggs. Alternatively, when things have it requires more advanced treatment, then we offer in vitro fertilization. In vitro fertilization, or IVF, as you've probably heard out there, is where we basically mimic what happens naturally in the body, but we do that outside the body. In this case, what we do is to give the woman injections which ensure that she is able to ovulate. And after ovulation, or before ovulation, actually, we don't allow the woman to ovulate. Before ovulation, we harvest those eggs. So the eggs are harvested, they're removed from the ovary, and then we put them in a petri dish or in a test tube in the lab. We mix with the partner's sperm so that there is fertilization in the lab, and we incubate that in an incubator at 7 degrees Celsius, that's body temperature. And the fertilized egg is able to grow. And on the 5th day, when it is supposed to be implanted, then we transfer that embryo back to the woman's uterus. A bit detailed, a bit costly, but it's successful. And those are some of the methods, and they're available in this country. So those are some of the treatment methods which are available also in this country. So if a patient has endometriosis, we may give hormonal medication, or if it is so severe, we may advise to do surgery. For your inquiries about fertility, infertility, and any other concerns that you may have, we are found at the �𝗲𝗎𝗍 Hospital, which is within 𝗙𝗍 Estate near Kenyatta Market, near 𝗙𝗶𝗱𝗃𝗃 Hospital. Don't forget to subscribe and also share with people or friends and family who may actually benefit from this information. This is Dr. Aurora Maranga. See you next week when we shall be talking about the other causes of infertility, including fibroids, including endometriosis, and all that kind of stuff. Thank you.